For those Malaysian returnees, it's been managed by NATMA and MKN. So Ministry of Health, we have our advisory in terms of do's and don'ts, but our role is basically to screen them, to make sure that they have no symptoms. If they have symptoms, we will isolate them, we'll test them, we'll isolate them, and we treat them. So I think it is indeed a challenge for us to look into it, but this is how we think that if we can actually quarantine them for 14 days, we can assure that, we can actually break the chain of infection, of COVID infection. But I also like to mention about the death, 65 cases that we have. And if you look into the data that we have today, 60% of the death age more than 60 years and above. And the cluster tablet, sleep-taling, death is 30%. And in terms of comorbidities, diabetes, hypertension, or ischemic heart disease or cardiovascular diseases, so the percentage is about 75%. So it's quite high for those who have comorbidities, because the symptoms will be worse than a person who do not have a comorbid issues and problems. It's true that we have the cluster total 1,682, index cases 765, first generation 694, second generation 190, third generation 19, fourth generation 7, and the fifth generation is 7 as well. So we continue to monitor this group, but we think that after doing our screening for more than 21,492 and also the close contact, especially the family members, I think probably we have achieved quite a significant numbers, but rest assured that we still believe that there are a few more not detected yet. Maybe they are still abroad, they have not come back yet. So, but what's more important is for them to come to our facilities to be tested. So we encourage them to come forward to be tested so that they can protect themselves, they can protect their family, and they can protect the community. We are monitoring very closely every day in terms of the increased positive cases and also the distribution or the distribution in the states as well in the district area. So as far as we are concerned, there's no exponential growth that has been seen in our cases. Although we have not won the war yet, neither have we lost the war. But what's more important is for us to monitor closely, and perhaps we need to have a few proposals. But more importantly, Ministry of Health is based on facts and science. So it's not about my opinion, but it's the facts and science. We are looking into it. We are doing the modeling in terms of the projection, and so we have seen the initial reports, but we still need a day or two for us to analyze the whole data. And with the data in hand, Ministry of Health will put up the proposal to the Cabinet and Prime Minister. So the decision, I feel, option is available, and the decision is up to the Cabinet and the Prime Minister.